Hello, exposed healthcare people. This is your host, Steve Mallon, and I tried this yesterday. Got some feedback that was interesting. Um, First, got some good feedback from people that they liked the call outs and they were engaging with the content. Also, got some feedback from non healthcare people that it was like tough to swallow the content. I guess because I was speaking on behalf at the level of a healthcare person. So maybe I'm going to try to speak at the level of a patient today to be a little more digestible. So basically, going down my LinkedIn feed and going to be spreading what my contacts are talking about, and then also giving kind of my perspective on it. So Hillary Blackburn, cool person, pharmacy leader, talk to your pharmacist podcast host out of Tennessee, I believe. So let's see. Another opinion. There are medically underserved areas designated by HRSA. However, pharmacies aren't included in this. Although many pharmacies are the sole healthcare provider in a town, policies to help pharmacies in rural and underserved areas, like other safety net entities, could help keep these pharmacies afloat and provide a needed access point in these rural areas. Summary of the article. The total number of community pharmacies has been falling since 2015, notes this opinion piece, but the trend has been particularly pronounced in rural areas, which have lost about 10% of their pharmacies in 2 decades. An example of this phenomenon is Canby Drug and Gifts, a pharmacy in rural Minnesota. It does good business, yet it is always on the verge of shutting down. I'm one bad contract from closing, says owner Mark Whittier. His pharmacy, one of a few in his county of more than 9,000 people, exemplifies the struggle many independent pharmacies face. The store is a lifeline for customers, most of whom are either on Medicaid or the state's health insurance program, yet profitability is now near impossible because of the way the United States distributes pharmaceutical drugs. A solution to these problems is to make it more profitable for pharmacies to serve low income patients. This would require a heavy hand from the government. States could change the incentive structure and pay more for drug purchases through their assistance programs. This would cost governments more, but it would help stabilize independent pharmacies and give chains a reason to remain where they're most needed. Banning PBMs from charging payers much higher than what they reimburse pharmacies for all taxpayer funded programs would direct some of the savings from drug discounts to pharmacies. Whittier says such reforms are about fairness for pharmacies, but the opinion piece concludes that they also about fairness for Americans. Yeah, that'd be interesting. From my experience with Medicaid and independent pharmacies, is because of the $0 copays. There's actually a lot of fraud involved because the patients don't have to pay for the medication. So an independent pharmacy could just like fill. The patient doesn't have to pay. The patient doesn't necessarily have to get the medication. If a patient's paying $500, they're gonna be like, "Where's my medication?" But if it's zero, it's really hard to keep track. So that would be my kind of devil's advocate to this is the fraud in independent pharmacies, particularly with Medicaid, is rampant, is pretty strong. Um, I know in Brooklyn with the Russian pharmacies, there's a separate division of the fraud, whatever, enforcement that are just dedicated for Russian pharmacies because they do such shady things with the Medicaid patients. Another option is, I guess, nonprofit pharmacies, and I've seen those pop up. I've interviewed a few of them. There was one in New York. They're popping up all over the place, and those could work really well because they could take donations. They could apply for grants. They could, yeah. There's different ways that they can operate that a regular pharmacy can't. And then finally, there's another one with a donation, not a donation, a repurposing, so people can donate to a pharmacy their drugs that they don't use, and then it can be given to patients at a heavy discount. So there's a couple of different models with that. Okay, IGH, hotels and resorts, not medical. Okay, Wall Street Journal, Cigna, Humana exploring insurance mega merger. Uh, Joshua Free says, then if they merge with Costco and IKEA, we'll be living in the movie Wall-E combined with Idiocracy. I hear The Rock is running for president. That would complete the analogy. In all seriousness, the mega mergers of all the companies in healthcare, um, especially vertically integrating, is causing a lot of problems. From a business perspective, it's very good. It's very good for profitability. You're decreasing competition. You don't want to have a lot of different companies in a market if you're in the market. You want to be one of the few. You want to be the Coke, Pepsi. You don't want to be the like a million RC Colas. So if Cigna and Humana were to merge, that would definitely be good for their bottom line, and that would be bad for the not only the average patient, and they don't have to be Cigna Humana patients, just in general patient, but it would be bad for all the entire the entire stream that gets paid by Cigna Humana. So all the pharmacies, all the hospitals, all the doctors' offices, we've seen this time and time again because they're just decreasing. They can do whatever they want, and they own the entire vertical supply. So like Cigna has specialty pharmacies and different pharmacies. Bryce Platt, one of my good contacts, no way it should pass antitrust. And then my other contacts, Kevin Walker, the only thing I can think of right now is the inevitable merged name of Human Sig. That's funny. Yeah, unfortunately, Bryce Platt, if they pay enough money, it will merge. We saw that with CVS and Aetna, and it's constantly happening. So I would be surprised if it didn't pass. But who knows? I know that FTC is getting more strict on PBMs and antitrust and vertical integration. How the Affordable Care Act fuels healthcare market consolidation. Let's see what this is about. The Affordable Care Act, often called Obamacare, accelerates the pernicious growth of market consolidation in American healthcare. The national healthcare law reinforces the trend of providers, including doctors and hospitals, to merge into large regional health systems that dominate local markets. The law also introduces new rules and restrictions that will reduce the degree of competition in the insurance market. This growth of monopoly power is not the result of free market forces, but the deliberate product of public policy. Instead of honestly budgeting in order to finance healthcare, policymakers have repeatedly sanctioned monopolistic hospital markets in the hope that dominant providers will use higher revenues to cross-subsidize indigent and urban emergency care. The purchasing power of the Medicare program has been increasingly employed by the federal government to shape the structure of the hospital industry. So that's an interesting perspective on that. Okay. Let's see what's next. This has nothing to do with healthcare. Nothing to do with healthcare. Nothing to do with healthcare. All right, finally. Novo Nordisk finds compounded Wegovy up to 33% impure, sues Florida pharmacies. Novo Nordisk finds compounded Wegovy up to 33% impure. Yeah, so Wegovy is a weight loss injectable with an ingredient called semaglutide, and semaglutide actually can be purchased by compounding pharmacies in bulk. And because Wegovy and all the other weight loss injectables have been experiencing shortages, compounding pharmacies are able to bypass, in general, the law that they can't compound branded drugs. So compounded pharmacies make generic drugs into different compounds because they're generic, but they can't normally compound branded drugs. They can't take, again, Wegovy and make it custom and charge a lower price or whatever, the same price. However, because of the shortage, they are there's some argument to made that they are allowed, legally speaking. So what is this? Reuters. Novo Nordisk finds compounded Wegovy up to 33% impure, sues Florida pharmacies. Let's see. So Novo Nordisk said on Thursday it sued one compounding pharmacy and refiled a lawsuit against another after finding their products claiming to contain the active ingredient for its in-demand weight loss drug were impure, some by as much as 33%. The Danish drug maker said it found impurities in all the drugs tested from Wells Pharmacy and Brooksville Pharmaceuticals, both based in Florida. Novo first sued Brooksville in July and discovered a substance called BPC 157 in samples from Wells. Both cases were filed in Florida on Wednesday. Brooksville managing partner Terry Malice said in an email the company disputes the new allegations and plans to file another motion to dismiss. Wells did not respond to a request for comment by email on Thursday. The FDA banned BPC 157 from use in compounded drugs in September, saying it did not have enough data to know whether it was harmful to humans, but that it could cause dangerous immune system reactions. Nova said the compounded versions of Wegovy tested for Brooksville were also less potent than advertised, with one sample shown to be at least 19% weaker than indicated. Compounded products do not have the same safety, quality, and effectiveness assurances as FDA-approved drugs, and adulterated, misbranded injectable compounded drugs may expose patients to significant health risks. Nova said the lawsuits aim to stop the two pharmacies from selling products claiming to contain semaglutide, the main ingredient in Wegovy and Ozempic, and prevent Wells Pharmacy from claiming its products are FDA-approved or that BPC 157 has health benefits without making customers aware of its safety risks. Brooksville Myers said the company buys its bulk ingredients, including semaglutide, from FDA-registered facilities. It has tested its formulation with a third-party lab and found it remains potent for 180 days when stored in a refrigerator, 90 days when stored at room temperature, and 45 days when stored at 40 degrees Celsius. Nova has already filed 12 lawsuits against medical spas, weight loss clinics, and compounding pharmacies offering products that claim to contain semaglutide. The company said it had obtained temporary orders against 6 of these to stop claiming their products are authentic, FDA-approved, or associated with Novo Nordisk. Novo's biggest... Okay, so I'm not going to continue reading this. So, so it's definitely some truth to this problem. So there's some shady stuff going on in compounding pharmacies. Doesn't mean that all compounding pharmacies are doing shady things. Legally speaking, like I said, because it's on back order and there's a shortage, the compounding pharmacies are technically allowed to make it, but they do also have to do it properly, and it needs to be just as safe and effective as the original product. So the take-home message is be careful which compounding pharmacy you use, because there's definitely, like I said, some truth to that. Okay. All right. Let's see. Just want to find something good. There's a lot of not relevant stuff happening. Important stuff, just not that relevant. Okay. Ooh. Okay, this is a cool guy. Antonio Ciaccia. Stillmore, Ohio CVS pharmacies accused of staff-related problems. Ohio Capital Journal. So in Ohio, there's been a lot of medical errors happening from the CVS pharmacies. I don't know if more than other states, but at least they're being talked about. And the state is doing something about it. The Board of Pharmacy is doing something about it. There's a big movement right now with working conditions. And one of the problems with the working conditions is the safety for patients. If the working conditions are bad in pharmacies, obviously that doesn't have a good impact on the safety of the products that are being prepared for patients, whether it's checking drug interactions or just to make sure it's the right drug in general. So a lot of issues happening. And this guy, Antonio Ciaccia, is definitely one of the leaders in exposing not only that, but the PBM scandals that are happening and how they are running amok in the industry. Okay. Ooh, this one's going to be exciting. So, very excited about this. My first article in the American Journal of Endocannabinoid Medicine. If there are specific areas you would like to write about the future, please suggest in the comments. ECS, that's the endocannabinoid system, explained. Immune and endocannabinoid systems. So I guess this guy published something relating to the relationship between immune system and and the endocannabinoid system, which I don't know if you know, but your body has a whole system that's dedicated for cannabinoids. When you go for a run, you feel happy, you get a runner's high. When you smoke some weed, you get high, and it's this all like this innate system that you have. Marijuana just taps in, is like this product that you can use to tap into it, but this whole system, and it affects your body in so many ways, like the endocrine system, like the immune system. um, let's see if I can read anything beyond this paywall. The ECS acts as a regulator of central nervous systems. It is deeply involved in the regulation and nuance of the immune system. So the endocannabinoid system. The interesting thing is that by understanding how the immune system and the endocannabinoid system work together, we can gain a fuller understanding and appreciation for each and what each does. The immune system uses two major responses to accomplish this task. The innate immune response is rapid and occurs immediately upon encountering a pathogen. All right, let's see. Let's get back to interplay between the immune and that guy. That's gonna be good. This immune dance requires regulation. How does the body regulate between an adaptive and innate immune response? Is the ECS involved in this regulation? The interaction between the ECS and the immune system is intricate and appears to modulate both innate and adaptive responses. Here are some ways in that the ECS is thought to influence immune function. Immune cell regulation through cannabinoid receptor CB2 receptors, which are found predominantly on immune cells, including those involved in the innate immune response, such as macrophages and neutrophils. So macrophages and neutrophils are both cells that are very important for the immune system, and apparently they have cannabinoid receptors on them. What? Activation of CB2 receptors has been associated with the regulation of immune cell migration, cytokine release, and overall immune cell activity. So this is not saying that if you smoke marijuana, your immune system is going to be better necessarily. Not all cannabinoid products tap into the CB2 receptor powerfully, or it's just, that's interesting, very interesting. So there's some theoretical set with that. Inflammation modulation, in particular anti-inflammatory effect, is achieved by activation of cannabinoid receptors, particularly CB2 receptors, which have been linked to anti-inflammatory effects. This may influence the innate immune response by dampening excessive inflammation. So CBD oil, very easy way to kind of show some of that, has anti-inflammatory effects. Interesting. Cytokine production is regulated by endocannabinoids. Endocannabinoids can modulate the production and release of cytokines, which are signaling molecules involved in immune response. This regulation may affect both innate and adaptive immune responses. Interesting. T cells are impacted by endocannabinoid actions. Activating T cells through endocannabinoid action at the CB2 receptor has been implicated in regulating T cell proliferation and function. What I will say is, for myself personally, and I know other people have this thing as well, whenever I get sick, I purposely go to the gym or go for a run, and I've been doing this since high school, and somehow it helps. I've always thought it helps because it kind of opens up the flow in my breathing and like gets the mucus out, but it's possible that it does it through activating T cells as well, or the macrophages and neutrophils and everything that I'm talking about. Because when you run and you go to gym, you get like this high, and it's like a natural endocannabinoid boost. Balancing the immune system is critical for proper immune response. The ECS is often considered to be playing a role in maintaining homeostasis or balance in various physiological processes, including immune function. So I'm glad that I came across this post, because this is really exciting stuff. Chip Paul, very nice. Thank you for disclosing this, especially it's cold. At least if you're not in the center, near the equator. It's cold, and people are getting sick a lot. And a lot of people, because it's cold, are kind of staying indoors. And that's not making things better, at least if you're staying indoors doing nothing. So if you're feeling like you're getting sick, or even if you're feeling fine, do not just like lay there, be a couch potato, sit around and do nothing. Do something, exercise, get pumped, go for a run, go to the gym, put some YouTube on the TV and do some Zumba or whatever if you don't have a gym membership or you don't want to go run outside. But even play Wii tennis. It could boost your immune system, and surprisingly, through the endocannabinoid system. CBD oil is another option, although I would probably encourage you to do it through the natural mean. Like when you do it naturally, first of all, you have the endocannabinoid boost, but second, you're burning calories. A third, you're doing it naturally. You don't have to pay for it. So like CBD oil, you have to pay for it. So just from like a being cheap perspective, it's much cheaper just to go for just to do Zumba on YouTube or whatever. Do some push-ups, sit-ups, yeah. So I hope this video was a little bit more patient geared, because I don't want my content to be only for healthcare providers. I want it to be for patients as well. And if you have any questions about these different things that I've talked about or comments, please comment on the YouTube video, and I'll be posting this on LinkedIn as well, so you could post it. You could respond to my LinkedIn post as well. That's pretty much it. So I appreciate it. Thank you so much. Peace.